Hello everyone, today is May the 15th. I'm Dr. Adam London, Director of the Kent County Health Department. The state of Michigan is reporting 49,582 diagnosed cases of COVID-19 statewide. That's an increase of 1,191 over yesterday's number, and 4,787 deaths in total statewide, an increase of 73 over the previous day. Here in Kent County as of this morning, we're reporting 2,717 diagnosed cases. That's an increase of about 90 over yesterday's reported number. So we're still seeing a number between usually about 70 and 100 every day on average. And we're up to 52 deaths now. So we've learned of 2 additional deaths in the past 24 hours. And I think this is the 3rd day in a row that we've had deaths to report, sadly. And once again, as always, our hearts and our prayers, our thoughts go out to those who have suffered with losing a loved one during this epidemic. So we're still learning an awful lot about COVID-19 and how it affects humans. It's been a couple of interesting months. We've gone from knowing very little to knowing quite a bit. There's a lot more we'd like to know. Early on, it was assumed that, and it was observed, that kids did not suffer with the extreme consequences of COVID-19 at anywhere near the rate of adults and especially the older population. Thankfully, that observation has held true by and large to this date. However, we can't assume that children are totally immune or totally invulnerable to the consequences of COVID-19. In fact, we have sadly seen in parts of the country where children have been affected, now at a much lower rate, to be clear, than the rest of the population. Yesterday, the CDC issued an advisory through the Health Alert Network to health departments and physicians across the country, talking about an increase in reported cases of multi-system inflammatory syndrome in children in the UK and in New York that were linked to children that also were COVID-19 positive. So the numbers are still very low, and the actual risk to any child, any particular child, is very low from multi-system inflammatory syndrome. But it is one observation that has been seen so far, and so the CDC is sharing that information with healthcare providers around the country. So if you, as a parent, see that your child has a fever and has inflammation, swelling, redness, you should contact your child's pediatrician. You should call the urgent care or the emergency department like you would any other time if your child is sick with a fever and other illness symptoms. So again, the actual risk to any particular child is very, very low from this, but we all need to be very cognizant right now of fever and unusual symptoms and make sure that we're talking to our doctor as soon as possible about that. So while the risk of that is low, I can tell you that the risk of sedentary lifestyles and the risk of not being active right now, those things are real high risks of leading to adverse health outcomes. And thankfully, we're going to have some great weather this weekend. So one thing you can do for your children to make them, to encourage them to be more healthy is get outdoors, be active, enjoy the nice weather, get outside and have fun. I'm Dr. Adam London from the Kent County Health Department, encouraging you to stay positive, stay heroic, and stay healthy. And I'll talk to you again tomorrow. Thank you.